A two-day meeting between all 13 of Canada's health ministers and their federal counterpart began in BC today. Federal Health Minister Jean-Yves Duclos is expected to hear the ministers' call for additional funding and supports. This comes 4 months after Canada's premiers met in Victoria last July to ask Ottawa to increase the Canada Health Transfer. Provincial health officials continue to show a united front of frustration over what they call a crumbling healthcare system. All right, well, joining us now to talk more on Canada's struggling healthcare system and what needs to be done about it is Mr. Stephen Staples, the Canadian Health Coalition's National Director of Policy and Advocacy. Mr. Staples, welcome to Forum Daily.
Thanks for inviting me.
So a lot's been thrown at Canada's healthcare system throughout the past 2.5 years, sir, from the peak of the pandemic, a mental health crisis, a toxic drug crisis, so much being thrown at the healthcare system. How is it functioning right now?
Well, we're not out of the crisis yet, and it is hard to understate the results of the pandemic. We've lost so many healthcare workers from burnout that's increased wait times, and there's still issues of funding. And now we have some provinces talking about going more to the private sector, which is quite alarming to a lot of people. So there's no shortage of issues for the provincial and federal health ministers to be talking about this week.
No shortage of issues indeed, sir. Now, ministers are calling for additional funding, we mentioned, but this is not the first time that officials have asked for financial support in the health sector, particularly when it comes to the Canada Health Transfer. So how has Ottawa reacted in the past to these requests?
Well, you got it. The Canada Health Transfer is the big bulk of money that goes from the federal government to the provincial government for healthcare. It's over $40 billion and it's tied to inflation. So it goes up. So as inflation goes up, so does the amount of money that goes to the provinces. Now, the provinces complain that the amount is not enough and that they shoulder way more in terms of a percentage of public healthcare costs than the federal government has. And they want more. The federal government has been saying and continues to say, we're prepared to give you more money, but we want to see outcomes. We think it's reasonable to ask, what are you going to do with it? Will Canadians actually see an improvement of healthcare if we give you more money? The province's response has been, butt out. Healthcare is our responsibility. Just write us a blank check. And there you've got the standoff between the federal government that will give money but wants better outcomes, or at least to know what the outcomes are. And the provinces are saying, give us the money. We know what's best. Trust us to do what's right with provincial healthcare programs.
And we know the provinces are pushing for a meeting with the Prime Minister regarding the Canada Health Transfer. So how do you expect health ministers to achieve this goal through this week's meeting with Jean-Yves Duclos?
Well, we're looking for any kind of thawing or any kind of progress with Jean-Yves Duclos. I did notice that BC Health Minister Adrian Dix, who's chairing the meetings for these 2 days, did seem to distinguish between his relationship with Jean-Yves Duclos, the health minister. He's from Quebec City. He's an academic. He's quite approachable. And he seems to have a better relationship with Duclos. And he contained more of his chagrin, I would say, for the Prime Minister himself, pointing more fingers at the Prime Minister. So I think Jean-Yves Duclos is going to this meeting. It's the first meeting of its kind since the beginning of the pandemic. And hopefully he's going to find at least maybe even some non-monetary ways that they can work together, get the information sharing, data gathering, something like that, to begin to build the relationship. And then some money discussions will come later on. But there's still a lot of work left to be done.
Lots to keep our eyes on. A quick minute left here, Mr. Staples. But in addition to funding, what kind of additional supports and measures are health ministers going to be calling for?
Well, I think that's going to be primarily what they're looking for. They're looking for funding. They want to keep healthcare under their own purview, so they just want Ottawa to foot the bill. Certainly, Ottawa will be looking for outcomes, especially new programs. We have a dental care program that's coming online as a result of this phenomenal agreement between the NDP and the Liberals, which is delivering new healthcare programs. So pharmacare is coming down the line, which will impact provinces to some degree. But also, we've been looking for a national pharmacare program so that people can have the cost of their prescription medicine covered, and so it's not dependent on whether they've got private insurance or a big credit card balance available or anything like that. That drugs should be covered under our national program, and we'd like the federal government to pick that up as well. So we hope that that'll be part of the conversation.
All right, Mr. Staples, thank you again for joining us today on Forum Daily.
My pleasure.
We'll be right back.